Today, our guest is John, and he has an interesting, odd thing that's been bothering him, and it's been bothering him for a while. But what's more interesting is something that happened to him in his past. You want to share with us?
Sure. My pain is it's right below my ribs and just to the right of my sternum. So it's right here, very isolated. It has been years that I've been dealing with it. It flares up when I sit in a car for a long time. I've never been able to figure out exactly what it is. I've had an X-ray, I've had an MRI, I've had an endoscopy, I've had an ultrasound. They cannot find out. They can't tell me what it is. You wanted me to talk about when I was a sophomore in high school, like 14, 15 years old, I wrecked on a toboggan where I went off a jump and came over backwards and landed on the hill with my legs up here and just really hurt my lower spine and a lot. But I was never diagnosed with anything. I was just left to heal on my own.
Well, the good thing, there was nothing broken.
Apparently.
And nothing severed.
Nothing severed, for sure.
All the risks of youth are teen years, but sometimes they catch up with us. So the good thing is, he doesn't have anything else that's happened to him, or nothing major. And the other thing is, there's nothing from his early years that was of any interest, that anything unusual with birth or early development. So kind of the only thing in his past is this toboggan injury. And so what's unique about the way that he fell and then crunched up is he landed on his back. So there's trauma to the backside of his core. And then his legs were like flipped, and then the toboggan landed on top of that. So almost like you got pressed into a sandwich between your core and your legs. And what that does to the core is turn sideways. So the whole back side of him would be super stretched, and the whole front side of him would be super crunched up. And we never fall straight. So legs probably were off a little bit to one side or the other, which then pulls the spine a little bit off center with that as well. So I think that's what we're going to check, really globally basic things for him, just so we know what our starting point is. But we're also going to test and see what with that toboggan landing. Did you get a 10?
Yeah, I suppose I did.
He got up and walked away. So we're going to test and see what that may have done for him. So this is John. I'm Kara. I'm the founder of the Bridging Institute and the Bridging Technique. And what we do ultimately is we're resetting muscle memory. So even though it's been a few years for his accident, those muscles can still learn how to work together again. And they had a good foundation. So they should change. My background is I'm a movement specialist, and I'm also a systems engineer. And besides the muscle reset that we do, it's which muscles. So that's our problem solving. And I've already talked you through a little bit about what we're going to be looking at today. So it should be a really interesting problem gathering, information gathering time. And so let's get to it. So just stand. Let's just see globally, how are you moving? And he's tall, so it's hard for me to reach from side to side. So does he move from side to side easily? A little. Let's get stiff. And then we're going to turn. Okay, no helping me. But he doesn't turn to the right very easily and does not turn to the left easily. So turning would actually be nice in your occupation because you have to turn a lot, don't you?
I suppose, yeah.
Yeah. So sit. Let's see how you're moving when you're not on your feet.
Okay.
Which is probably not your life. Okay. Does your core move? No, not side to side. I'm trying to turn you. It's not moving. Forward and back a little bit. Wow. Yeah, your core is kind of locked up. So it may be that we find that that's the only spot that moves, and that's why it's getting stressed. So lay down on your back. So we're just going to do a quick check on arms, legs, core. See how it all goes together. And so I'm just going to lift each leg. Okay, don't help. So that moves. They're very similar in how they lift. This one turns. This one turns. So legs, just from a couple of standpoints, they're pretty good. And then let's see about shoulder. Very nice. And connects to core very nicely. And let's see about the other one. Oops. Okay, good. A little stiffer on how it connects to the core, but really not too bad. So I'm gonna scoop hands underneath your shoulders, and we're gonna see what moves there. Nothing and nothing. Wow, yeah, you landed smack on your back, so it's kind of like press you in and then freeze you there. And then I'm going to also, if I can lift, so one leg, one arm, we're going to see how your core moves. Okay, that's not going to move. And then let's see this side. I'm going to guess this one doesn't move either, but yeah, no. Okay, so everything in your middle is like frozen in place.
Is that a good thing?
There's room for improvement. So what I want to do is just, we're not going to put you in what happened, but we're going to lift the legs up. And if hamstrings get too tight, we'll let your knees bend. But yeah, they're going to. Okay, we're going to try to replicate a little bit of what happened and just see kind of where does his body go? Where do the muscles know how to interact between his legs and his core? So I can bring him up this far and stops, but let's see which direction. Left. Does not want to go to the right. So they're coming a little bit to the left and then up. And actually they're going to almost straighten out a little bit more. You okay? Mm-hmm. If anything gets tight before I know it's tight, then tell me.
Okay.
Yeah, so the direction his legs, they want to go up and then off to the left. And just to make sure, and because I know you're curious, those of you who are watching, yeah, I cannot get him to go to the right. Does that even cause pain?
No,
It stops. His body, I don't know if it's stuck or just rebels, but so we're just going to follow. So with accidents and injuries, we kind of go back to like, what's the relationship that got like frozen in time, and get the body to like let that go. And already I'm just rocking back and forth very gently his legs, and that relationship to his core is changing. And do you feel your lower back?
Yes.
So it should actually be relaxing. And there, his lower back just lengthened. So as I'm pushing up with his legs, his lower back is lengthening down. Can you feel that?
I can.
And so when you're doing yoga or some stretches, you're doing it just right, and you're bringing your legs up right in the middle and making sure everything's centered.
Sure.
Right, but where your body wanted to be was off to the left. So I'm still going over to the left, and it opened up a little bit more on the right side. And I'm not forcing anything, I'm just rocking back and forth and just letting the motion flow. And starting to unspiral, going from left to right. And a little bit more. Oh, it's almost going to go to the right. There you go. So his lower back is moving both directions now. And if you're paying attention, you can see the movement in the middle of his core. So I can feel it. I'm not watching that part, but when I look, I can see it now. You feel your back moving?
Oh, yeah.
Okay, and the more I go back and forth, the more his shoulders are actually starting to move. So he's getting a lot more movement through the core. So skiing, this would be like skiing kinds of motion, where legs are together, or snowboard. Here. And I'm going to come back up again. So what's nice that just happened is his hips are starting to open out, because I brought his legs up. And there's enough flexibility, space that's opening between his core and his legs, that his legs can start coming wider. And there we go. And So it moved before, but that's just so much easier. Same with that one. So let's see. Does your core move? Starting to. So the left side was harder. Oops. It's actually easier. So I'm gonna stay with just the left leg. There we go. And shoulder. And I'm gonna come back to the right. The right side's still a little tight. So let's do one more time with legs. And I'm gonna support differently. And coming over to the left more than, wow, because your core can turn more, so you come more this way. And the part that's also different, your legs are straighter. So this is starting to approach more of what really happened. So I'm not gonna push anything or force anything, but if you notice something that's tight where you're like, just say so. Okay. And I'm just rocking back and forth, up and down, and you can feel little changes through his back and his core. Actually, the back side of your legs. Okay, so when I was explaining what would have happened of what got overstretched, I forgot about the back of your legs. That got way overstretched too. So those muscles feel like they're kind of relaxing. And interestingly enough, like Achilles is softening and motion at your ankle is kind of relaxing a little bit. And where are you going? There you go. You okay? Wow. You weren't this flexible earlier.
No, I wasn't.
So I almost feel like your back is going to lift up a little bit, which honestly, for what happened, it would have lifted up and kind of curled backwards. So again, I'm not forcing anything, but do you feel all that motion in your whole back?
Oh, yeah, very much.
Okay, so you know where you pointed out about where you're having the issue? If you're watching and paying attention to where his core is articulating, he's actually starting to fold up right through here. And I betcha that might be part of what happened is like origami, the fold got shifted. There. Yeah, because it's almost like you're refolding in the middle the way that you should. And actually, now your legs are going off to the right. There. There. Okay, so let me try this right side one more time because that's what was not moving so well. Okay, very nice. And, okay, so the question that often comes up, especially when we've had some injuries, and is if this feels better and moves better, how long is it going to last? Well, we're clearing up the relationships that happened from the injury. So you really are not going to go back to what you used to be, like how tight everything was, but there may be more. So, there. Okay, so that left side is pretty easy to rock, and I think the right was also. Just want to make sure they match. Yeah, that feels pretty similar.
Yeah.
Yeah, okay, so sit on up. Let's see how you're moving. Okay, so he turns. I love it. And then side to side. Great. And then forward and back. You're moving. So stand up. Let's see what's going on. So you did go side to side before, but just a little bit. So you got much easier motion. Do you feel like you're going to fall at all?
No.
Because you're moving through legs and core much more than you probably have in a long time. So I'm gonna hold down a little, actually more in the middle, and just kind of rock you back and forth, because I think it's been a while. Your body actually needs to trust itself on how to move. So for those of you watching, you should just see the ease and the range of motion start to increase. I'm actually not doing anything more. It's just his body starts to trust. So, do you feel your feet now?
Absolutely.
Yeah. Been a while. There. Okay, so now we're gonna turn. Oh, wow. You didn't turn before. This is huge. There, okay. And then I'm gonna front and back, so we're gonna match up front and back. Yay. Now, one of the other things when there's been an injury that's at the root of what we're working on, you might be a little sore tomorrow because there's a lot of muscles in your core, especially on the back, that haven't worked this way now that they're put back together. They haven't worked that way in many years. And so even just standing is making them work in a different way than what they're used to. They're back to how they should, but it's kind of like just standing up as a workout. So just give it a couple of days and then they should be fine.
Okay.
So,
Okay.
But, okay, thank John. What a great example. What a very interesting set of circumstances. And we will be checking in with him to see how he's doing. And hopefully you'll be able to come back in the future. He doesn't live locally, so we'll have to work with his travel schedule. But just to review, he had a weird pain right at the base of his rib cage, and the only thing in his past is a weird accident. And so we just worked through, kind of positioned him in what went on with that accident, let his muscle system regroup and reset, and all the restrictions that kind of were frozen in place were able to melt and go away. So if you like this episode and found it interesting, give us a thumbs up. If you haven't subscribed to the channel yet, please do that so that you can stay on top of all the other interesting episodes and see John when he comes back.
Yeah.
And yes, if you would like to be a guest, just let me know. And if you'd like to come into the office to work on the residuals of some weird accident that you may have had, we're located in the northern suburbs of Chicago, so look us up. The information is in the show notes. And for those of you who may be interested in learning the bridging technique, we will be having workshops in 2024, and that schedule will be on the website. Thank you for joining us, and thank you for being here.
Thank you so much. I really appreciate it.
You're welcome.
A lot. Thank you.